My name is Malicki. I've been a nurse for 20 plus years. For the last 16 of those years, I have cared for the intensive care population in an oncology setting. We've incorporated ELNEC into the practice and in my personal practice here in the intensive care unit because of all the prognostic uncertainty and all the high-tech arena that these patients are cared for. We have learned that they actually need more support by the nurse actually not just doing things and using these monitors, but by actually being with the patients. We folded in some of the concepts of ELNEC, of pain management, symptom management, communication with the ICU, not only staff, but the patients and families. And then we sprinkle leadership into that. So ELNEC provides us with the structure that allows us to care for our patients in a more complete fashion. The most significant ELNEC module for me personally was the loss, grief, or the grief, loss, and bereavement. It talks about the different types of grief. Also, it incorporates cultural competency into that. I think that sometimes we expect our patients, and actually nurses too, because nurses suffer a sense of loss and a sense of grief and bereavement when losing patients. I think that sometimes we expect people to follow a recipe card on how they grieve and what we're supposed to do. ELNEC gives us a broader concept of grief, loss, and bereavement, allowing the nurses to care for patients and themselves, understanding that grief is a process that's individual to each person and that you take 3 steps forward and maybe 2 steps back. And it supports these ideas and gives us the tools and the words and the stories that are necessary to do a nursing job. I think that all nurses and all disciplines actually that deal with people should take ELNEC courses. It allows us to develop a sense of well-being, a sense of understanding of who our patients are and who we are as people. We have to, death is inevitable, and I think the way we deal with it lends itself to needing tools and understanding who we are as a people to help others that come before us. And it's a patient-centered, family-centered concepts that ELNEC also provides.